Um, we have the honor of having Dr. Richard Wright with us this morning, and we are excited about that. Dr. Richard Wright, as you know, is a doctor here in Lake City, Florida, that has the largest family practice in North Florida. He's been a friend of mine since the late 70s, after he walked into the Lake City airport that I happened to own and operate for 4 years, and walked in and asked if he could get some flight lessons. And so he and I have been friends and close friends for 30 plus years, and in fact, he actually several months ago saved my life. So I don't know that I ever saved his life in an airplane. He was a good pilot, but I had the fortunate relationship with him that he actually saved my life several months ago. So, Dr. Wright, we're so glad to have you on the call. Welcome aboard this morning.
Thank you very much, Frank. It's good to be with you, and I'm looking forward to talking to everybody throughout the United States and hopefully some folks in Canada as well, but we're sure excited to be able to do this.
Well, thank you very much. And so, just getting underway, Doc, one of the main things is here you are part of the Qivana business, and I'm sure everybody wants to know how you get a doctor on board. So, would you please comment on kind of what puts you in and the relationship that probably is necessary in order to even get the attention of a physician?
That's an interesting question, Frank. Having many years of medical experience myself, I find it as well hard to talk to doctors sometime, and so I'm sure the rest of you have the same problem. We're all very busy, and we've spent a life of scientific experience and scientific investigation to try to be able to handle the medical problems that we deal with on a daily basis. So consequently, you get doctors that are busy, that don't have a lot of time for outside friends, outside relationships, and sometimes new concepts. And I guess the first thing is sometimes they need to have a new approach to things, and maybe even sense it after 20 or 30 years of medical practice that, hey, I need to do something different. And sometimes there's an open door there that you can breach by your personal friendship or possibly your personal relationship with a doctor that gets you in the door and say, here's another way of doing things I would like to give you, not only a business opportunity, but an opportunity to look perhaps afresh at your own profession and say, is there something that you personally would like to change? And as a physician, I experienced that with my opportunities in Qivana by a friend that exposed me in the same way and said, hey, I want you to listen, give me a few minutes. Would you do a little research? It's kind of like trying the core essentials. You say, give this a try and see if you like it. Well, as a physician, that's one of the things that interested me, and I did some research, I did some interest in. So the first thing is you got to challenge him to be able to open his mind to a new concept. It's really helpful if you have a professional in the field that can speak intelligently with him about the natural products and give him some groundwork so that he doesn't feel like everything is going to be just another general nutrition center gimmick or something, that it's going to be something that's really real and that has good scientific backing. And to do that, he's got to do a little research. So you got to get him in that mode, and all of those things that I said, friendship and titillating somebody's imagination as to another opportunity, perhaps business and in the professional field as well. It's going to take some hard work and perseverance, but sometimes the rewards will be very good. I think we're worth it.
Oh, without a doubt. You spoke just a second ago, you said, speaking of scientifically backing the products, I know you have used these into your own practice, Dr. Richard, and would you comment just a minute on some results you're seeing within your own practice, both metabolic and core?
Yes, I will be glad to, Frank. Actually, I have some designated employees in the office that really work from a Qivana standpoint, both as a business standpoint, but also from the natural products used in my medical practice on a daily basis. And we're talking about literally hundreds of patients that I have had experience with over the last several years. One of the big things, of course, is the metabolic weight management system, because I have a broad-based medical practice, and we take care of the people that are very ill, people with congestive heart failure, diabetes, elevated cholesterol, hypertension, cancer, GI diseases, obstructive sleep apnea, all kinds of diseases. And one of the first things you find out is that how many things can you affect the quickest in a patient's health care to give them the biggest benefit. And in most cases, quite frankly, you're going to see a common thing to most medical patients is that they usually have 20, 30, 40, 50 pounds of weight they need to lose. And if you can accomplish that, and we have been successful in doing that in a large number of cases with a metabolic weight management program from Dr. Donald K. Lehman, who, by the way, is one of my idols. I have researched him for 27 years. He is one of the sharpest guys that I've ever met and is a pathfinder in the field of amino acid metabolism, protein metabolism, and nutrition. And so with the experience that I had there with the metabolic, I've seen patients' cholesterol go down dramatically, and I'm talking about all components of the cholesterol: blood pressure, blood sugar, arthritis gets better, obstructive sleep apnea, depression, insomnia, the secondary things that you don't think of that are so much benefited by this. And quite frankly, in a program where I have been able to get patients to be able to take the core system, and that includes metabolic, the detox, and the core essentials, and the probiotics, I have been able to get a lot better success because I can show clearly that just taking the essentials alone positively affects blood sugar and actually all components of the cholesterol, total cholesterol, triglycerides, HDL, LDL are all positively benefited. Blood sugar is less and appetite is decreased. People do better. You know, you add the detox system to that and you've got an extra benefit as well, and people feel better.